So very pleased to be giving you an overview of Asas, which is the Urdu language word for compassion and empathy. Asas is the name of our new social welfare program. It's a multi-sectoral, multi-component, whole of government program aimed at social protection, creation of livelihoods for the poor, human capital development, and making the government system pro-poor. And it is predicated on the understanding that it's not just the government but the private sector which also has to play a part in accruing social welfare benefits to the population within our country. So I just want to take you through the poverty trends. There are two ways in which poverty is measured in the country. So in terms of measurement of poverty at the population-wide level, we use two metrics. We use monetary poverty measures, and based on that, poverty has declined from somewhere in the mid-60s to around 24% as it currently stands. You can see the trend lines here. But we also, as the state, as part of official state policy, measure poverty based on the Multidimensional Poverty Index. The numbers for this composite measure come from the Pakistan Social and Living Standards Measurement Survey. And the last round was done in 2015. It was then that the MPI for Pakistan was computed and it was reported at 38.8%. Currently, the new Social and Living Standards Measurement Survey is in the field. It was done on the computer-assisted approach. The data is being currently compiled and cleaned. And very soon we'll have official numbers based on which we will compile the new Multidimensional Poverty Index. For our work, for the work of my ministry, which is poverty alleviation and social protection, this is a hugely important metric. And I will explain to you why that is the case. Because Pakistan has 154 districts. We are a very large country with a population of 200 million plus, 154 districts. Some of the districts are larger than many sovereign countries. But there are huge disparities in terms of health outcomes, education outcomes, broadly the welfare outcomes. Day before yesterday, the Prime Minister launched the Asas Data for Pakistan portal. And you can just see an illustration of that here. This is the landing page of the portal. And if you follow the legend, you will be able to see that the north of the prosperous districts in the country are in the north. The more impoverished they are, the more they're concentrated towards the south, and there are pockets of extreme poverty within this framework. So Pakistan is a federal country, which essentially means that it has federating units. And under the National Finance Commission Award, the federal government gives one-line budgets to the federating units, and then they have to decide how to allocate monies towards their districts. And then within the districts, a decision has to be taken on how to allocate monies towards each sector. And these maps, these poverty maps, the maps that are based on the MPI, are extremely valuable for us because we want to push the needle towards a paradigm where the provinces will start making Provincial Finance Commission awards to the districts based on the colors that we see, number one. And then based on the performance of individual sectors, the districts will decide which sector to give more money to. So there are two very important uses which will come into play in terms of fiscal allocations as a result of what we hope will be the effective use of these data. So, as I said earlier, the MPI was computed in 2015, but the data did not exist in a format which would allow the provincial and district governments to make decisions based on those data. So the Data for Pakistan portal is an immensely valuable tool to enable that, and it so happens that it was launched day before yesterday. I just want to show you a couple of slides to to bring that to put more granularity. So this is one of our districts, the district of Bar Khan, where the net primary enrollment of boys is 85%, and the net primary enrollment of girls in schools is 24%. Now, if a district has received a one-line budget from the province, and of course they now have the ability to segregate data across 120 indicators for their district, they will be able to see where the need is the most. Maybe in sanitation the gap isn't this wide in terms of rural urban, or maybe in terms of health the gap isn't that wide. So the intra-district sectoral allocations is something that will benefit significantly from the use of MPI. And then more broadly, even in terms of the award to the districts by the provinces can be significantly benefited if this tool is effectively used, which is what we're going to push for. So you can see within each province, the districts are not at the same level. And as I said, we are really looking forward to the next round of MPI, because that is going to give us fresh data. And the reason why we launched the portal now was because we wanted to get it up to date. So up until 2015, all the data is now in there. And when we put the next round, then of course we hope to push our federating units. Please use it for the awards to the province, for the provincial awards to the districts, and for the districts to use it sectorally. I just want to now give you a little bit of an outline about SRs. Basically 4 big goals, I beg your pardon, basically 4 big programmatic areas: to address elite capture and make the government system work for equality, to provide effective and comprehensive safety nets, to create livelihoods and jobs for the poor, and to invest in human capital formation. And the cross-cutting goal is to lift lagging areas. And again, the MPI is an extremely important tool, because how will we know if an area is lagging? If the Data for Pakistan portal is not there, how will we know that an area is lagging? So that's a very cross-cutting aspiration for us. Whatever programmatic interventions we conceptualize, roll out, we see where the need is the most. Very quickly, 6 values which SRS is embedded in. Its principles are centered on inclusivity, on equalizing efforts, on mobilizing multi-sectoral support in a partnership-driven model. And our definition of partnership also includes the private sector. The focus on governance is a hallmark of SRs, because we feel that we can continue to come up with programs, but if the backbone on which these are delivered is not grounded in integrity, there will be mistargeting, there will be pilferage, there will be hemorrhage from the system. We are also very conscious that in the 21st century we have to leverage digital tools, we have to use technology to the fullest, and that because there is a huge gender gap across a variety of different variables, that unless we harness the potential of the 50% of the population, which is women, we will be missing out on opportunity. The human-centric approach is very important to us, because people in the field do not understand, their needs do not correspond with programmatic priorities. Their problems are not packaged into the programmatic silos in which we work. So across SRs, when we roll out programs, when we conceptualize it, we're very conscious that the human-centric approach has to be an important part of that. Policy synchronization for us is key because it's a multi-sectoral program. And dignity, of course, stands above everything else, because this work is for very marginalized people, for the poor. So if you're not going to deal with them in dignity, you lose a huge opportunity. ESAS is innovative because of its scale. It's an umbrella initiative of 130 coordinated programs. It has a multi-sectoral character, mobilizing 34 agencies, ministries of the federal government and the private sector. And the focus is on precision. You really have to. So despite its breadth and depth, and despite its diversity and multisectoral character, the focus is on human-centeredness at the individual and precision in giving safety nets. To implement such a big program, we had to make special arrangements. So the program itself was developed in about 45 days. An extensive round of consultations we had. A new ministry was created. The funding for social protection was doubled. And right at the commencement, we got cabinet approval for the governance and integrity policy of ESAS, which articulates 27 measures which are now very rigorously implemented in the governance observatory. Because a lot of this work is about giving payments to people, social protection payments, we had to procure a new digital payment system. We had to revamp our information technology systems. A one-window ESAS is close to deployment. And for governance, we formulated stakeholder committees and expert committees. So from the articulation of the policy on March the 27th, to the formulation of the strategy, articulation of the goals, creation of the implementation plans, the M&E strategy, this has been quite an exciting 1 year. And I'm very grateful to the UN system in Pakistan for the help and support that they've lent to us for this. In a nutshell, there is our steering committee chaired by the Prime Minister, which I can convene in his absence. Then we have the stakeholder committees and the expert committees. And then there are execution mandates with the Ministry of Poverty Alleviation, federal ministries and provincial departments. So the color coding will help illustrate as the colors move around. So the green are my responsibility. These are largely social protection related. So myself and my ministry have two roles. We are the executors of the social protection arrangements, but we are also the coordinators of ESAS. Each federal ministry has an average of about 3 actions to execute under the framework of ESAS. So we've embedded welfare in the scope of workings of every ministry. I'll give you an example. For instance, the Ministry of Overseas Pakistanis is meant to increase the number of protector of immigration offices, is meant to make sure that there's biometric attendance for overseas worker Pakistanis so that they become aware of their rights. For instance, they are meant to ensure that the number of labor attaches increase, because there are lots of Pakistanis who go to the Gulf for very low-end work, and these are very uneducated people, many of whom are traveling for the first time outside the country. So how do we cater to their welfare? This is one way. And similarly, across 34 federal ministries, welfare is embedded in their scope of work. Now you will see the colors move around. So if you classify, there are various ways of classifying ESAS, and if you classify it based on the whether it's safety nets, human development, livelihoods, or poor governance, you'll see that the colors have shifted. Most of the safety nets fall under my umbrella, but there are some actions with other federal ministries also. Another way of looking at it, classifying ESAS, is who does it target? Does it target orphan, widows, homeless, jobless, differently abled, poor farmers, undernourished, non-affording students, poor women, poor elderly citizens, those at risk of medical impoverishment, laborers? And the last piece is does it target the government for pro-poor governance? So these are 14 target groups. And if you classify the actions, this is how the landscape looks like. Then of course, all these actions go into the log frame, and we know how they are contributing to goals. So the blue and the pink, the goals for them have not been defined as yet, but the greens, the goals are specifically defined. So that's my execution shop. So what are the actions that go toward? So we have time-bound, outcome-based, quantifiable goals for safety nets, for financial access to healthcare, for financial access to education, for livelihood, for financial and digital inclusion. These are specific, quantifiable goals, and we know which execution agency is responsible, which program is responsible. And then from there, the implementation plans of each program. So there's a whole new Pandora that opens after that. All of these things are linked by this theory of change. What are the input level things? How do they contribute to programs, and how do they all gel together? Just a graphical way of bringing all the logos together. There are programs, and this refers only to the social protection side. Now I'm talking about execution. So programs and cash transfers, information, data and governance initiatives, convening platforms, private sector mobilization initiatives. And then in the last, you can see embedding welfare in the mandate of ministries. There are 8 things that we have fast-tracked, because these are the things that benefit people immediately. And I'd like to make an important distinction here, because there are lots of policy initiatives in SRs. For instance, the data portal that was launched day before is an important initiative, but people will not see the tangible benefit. So if there's a policy to open bank accounts of all laborers, for us it's very important, because we can track minimum wage. We can track if they're going into social security. We can track if they are enrolled in the pension scheme. But the man on the street doesn't understand that. The man on the street understands if his child is getting a scholarship, can get a scholarship through SRs, if his poor widowed sister-in-law can get a stipend, or if a poor relative in the village can get a cow, or if a pregnant relative can get a specialized nutrition food. So these are the 8 things that we are kind of putting more at the front end, so that the public understands the value of SRs. So the blue logo there is the logo for our soup kitchens initiative. The next one is for scholarships. Then the third one, and I'm moving from the right side, is the interest-free loan. Then the next one is an asset transfer program. Then is the social protection program. Below it is initiative to protect against catastrophic health expenditure. Next to it, our nutrition initiative. Next to it, the SRs digital. Quickly take you through these. I'd like to walk you through some of the key social protection programs and their features. So Kifalat, which means helping someone in a special way, that you are, looking after their needs. Through this, we give rupees 2,000 every month. Target is 7 million women by end of the year. This is also a program of digital and financial inclusion. So every woman has a bank account, and we've opened for the first time in the country a demand-side registration system for it. And for the first time, women have access into banks to take money from ATMs, which has never happened before. Under our National Poverty Graduation Initiative, we have two major programs. One is an asset transfer program, one is an interest-free loan program. Through our interest-free loan program, we give loans of up to 75,000 rupees, 80,000 loans at an average every month. These are to the very, these enable a small entrepreneur to have a push cart, buy some material for a shop, maybe buy a coat, buy a sewing machine. A lot of existing entrepreneurs will buy stock for businesses they already run. Very powerful program. Then the asset transfer program is another program through which the government has committed to giving 200,000 assets over 2 years in 23 of the poorest districts. So for us, the asset is a cow, is either livestock or material for a shop, or it's a body of a rickshaw, assuming that the person has a motorbike, or a small or welding equipment. So if a carpenter asks for, and there can be allied skills training alongside as well. Then this is under SAS we also have the largest need and merit-based undergraduate scholarship program, and this is a paradigm change in scholarships that SAS has brought, because previously all scholarships were given at the MPhil and PhD level. They were all merit-based, so the need never factored into the equation. 50,000 scholarships every year on need basis. Very powerful program, heart-wrenching stories of the kind of children who were able to avail this. Then is our soup kitchen program, which is in collaboration with a very reputed trust that specializes in producing meals at scale. And the beauty of this program is that it's costing the government zero, because the public-private partnership model is that we give them land to construct the soup kitchens, because they have the capacity to produce meals at scale, but they can't operate in places where there are laborers, because there are little tea shops and vendors who displace them. So the government guarantees the security of their operation, gives them land, and they provide hugely successful program where they're laborers, where they're hospitals, in places where the poor are likely to congregate and forego meals. A program in collaboration with the World Food Program to provide specialized nutrition food supplements to pregnant and lactating women, because stunting is a priority for our Prime Ministers. I have to acknowledge that stunting is a very complex issue to handle. There's repeated infections, water, sanitation issues, lack of breastfeeding, a number of maternal practices, overall undernutrition, poverty, repeated diarrheas, all are contributory factors. But and each one of them needs to be addressed. Living conditions, for instance. But there's individuals at risk, and for them there is a therapeutic agent that is already there that has documented efficacy. So in collaboration with the World Food Program, we are fast deploying this, and hopefully in the month of April our first hospital where this is going to be deployed will be open. Tahaffuz means protection. This is a new program. Again, we're going to launch by the end. Work on this is fast ongoing, but formally it will be opened in another 2 months. People who run the risk of spending catastrophically on health especially and those who do not have the government health insurance will be able to apply through this. By the way, another sister program that we have is the health insurance program, which is run out of another part of SARS but run out of the Ministry of Health. That has a certain ceiling, but when that ceiling is crossed, or for people who are not under that scheme, this is the tool to be able to respond. SARS Digital are one window operations tying everything together. Fast, different pieces are getting deployed, and very soon everything will be integrated. Very quickly on SARS data initiatives, we are conducting the first door-to-door, end-to-end digital survey of the country. It's fast getting completed. We already talked about Data for Pakistan portal. In terms of the SARS information initiatives, the SARS app will be launched shortly. We already talked about the various convening mechanisms we have, the Nutrition Council, and in terms of the interplay of the UN system, UNICEF is involved with us in the Pakistan National Nutrition Council. The Labour Expert Working Group is co-chaired by ILO. The Poverty Alleviation Coordination Council, all the UN and development partners are members of. They're also members of the SARS Partners Forum, where we also host the bilaterals and the multilaterals, and then the SARS Disability Network, which our president and the First Lady chair, and we host the secretariat for that. So these are the stakeholder and expert committees who are called upon to give advice, wet work, take part in advocacy across various dimensions of SARS. The governance and integrity policy is a very important pillar of SARS, and all the implementing agencies have to abide by the governance and integrity policies. The private sector initiative, the policy will be launched soon. There are a number of different avenues for the private sector to get involved, and hopefully when the policy is released later this month, the coronavirus situation permitting, I'll be very gladly elaborate on the different dimensions of it. Monitoring such a huge program is a challenge. We have set up elaborate mechanisms for that. We track 3 milestones, major inflection, and then different inflection points within that. Has the policy for that initiative been articulated? Has the program been set up? And how are we going to deliver services? So the screen just shows a snapshot of the current status, and our dashboards for that can separately be viewed. Because SARS is a federal program, we are clear on how we engage with provincial governments. Our federal programs have a provincial footprint, and then we have specific asks of provincial programs. So it's a very exciting initiative. I've spent a very long time in the international space working as commission chairs and on advisory committees, and at least for the last 1 decade we've talked about multi-sectoral action and of the power of mobilizing the whole of government. And because my background is in NCDs, this was really the foundation of what we conceptualized over the years. And even in the framing of the Sustainable Development Goals, the whole of government approach to development endpoints, the importance of engagement with the private sector with appropriate safeguards, this whole premise of coordinated delivery, all this is so foundational to the SDGs, but they're very limited understanding of how this rolls out into implementation, very limited experiences. So with great humility, I would like to believe this is perhaps one of the first whole of government programs at this scale with such level of ownership. And for us, every day is new learning. Every day is new learning, and we're really pushing the frontiers to do things in a new and novel way, and of course learn in the process. And I want to thank all the partners who've helped us.